Hi, my name is Brittany Moore. Today is November 10th, 2025, and I am doing my neurological exam for MSN 572. Here is my computer, and here is an ear check, and then here is my room scan. There is the floor. Ceiling. Nothing back there. No one back there. All right, and then I do have some supplies. They are right here next to my volunteer patient. Also, to let you know, my volunteer patient is 11 years old and I am his mom. So I will be giving consent for this video to be filmed and uploaded to YouTube as unlisted for viewing and grading purposes. So I'll go ahead and get started. I'm cleaning my hands with hand sanitizer. And hello. My name is Brittany Moore. I'm a family nurse practitioner student from United States University. How are you?
Good.
I'm going to be doing a neurological assessment on you today, okay?
Okay.
So let's go ahead and get started. So I just need you to tell me your first and last name and your birthday.
James Moore, January 24th, 2014.
Great. And can you tell me the date today?
November 10th,
And what year?
2025.
Great. And can you tell me where we are right now?
At home in Utah.
And can you tell me what we're doing?
A neurological assessment.
Wonderful. And then can you tell me what you had for breakfast today?
Cereal.
And can you tell me what you did for your birthday last year?
We went rock climbing.
That sounds like fun. Can you also tell me if you were to find an envelope on the ground and it was had a stamp on it and it had an address on it, what would you do with it?
I would put it in the mail.
Great. Okay, so I can tell that my patient is alert and oriented to person, place, time, and situation. I can tell that his remote and recent memory is intact, and his judgment and reasoning skills are also intact given his answers to the questions that I asked. His speech is also clear and coherent, and it's appropriate as he answered those questions appropriately. So next I'm going to get started with the cranial nerve exam. So the cranial nerve exam goes through all 12 cranial nerves. We'll start with the olfactory nerve, which is cranial nerve 1, and I'm going to have you just let's check your nostrils. So plug and breathe. Good job. Now I'm going to have you close your eyes, plug your nose on one side, and then tell me what you smell.
Vanilla.
Great. Good job. And then do that again on the other side, and then close your eyes, and what do you smell?
Coffee beans.
Great. So that tells me that the cranial nerve 1, the olfactory nerve, is intact. So now I'm going to test cranial nerve 2, the optic nerve. The first thing that I'm going to do to test this is a Snellen chart. In clinic, I would be 6 feet away, but for the purpose of this video, I'm just going to stand right here. So I'm going to have you cover, first of all, do you wear glasses or contacts?
No.
Good. So I'm going to have you cover one eye and then tell me the smallest line of print you can read.
LTFPH.
Great job. So 20/20 uncorrected, and the left eye, and then go ahead and cover your left eye, and we'll assess your right eye.
LTFPH.
Okay, I have 20/20 uncorrected in the right eye, and then we'll read them together.
LTFPH.
Great. So that's 20/20 uncorrected in bilaterally, and that is the first assessment for optic nerve, or for cranial nerve 2, the optic nerve. So now I'm going to do the confrontation test, which is the test for peripheral vision. So I'm going to have you just face me, and then I'm going to close my right eye, and you're going to close your left eye, and tell me when you can see my fingers wiggling.
Now.
Okay, other eye closed. Okay, tell me when you can see my fingers wiggling.
Now.
Great, and then both eyes open.
No.
Great, and so I can see that his peripheral vision is intact, as evidenced by the static wiggle test, which is the confrontation test. And the last thing that I'm going to do is I'm going to check his, I'm going to do a fundoscopic exam with the ophthalmoscope. So some safety while I'm putting it together. I would have the lights dimmed in clinic, the diopter set to 0, As I'm assessing his right eye, I'll use my right eye and my right hand. As I assess his left eye, I'll be using my left eye and my left hand. I'll have my index finger on the top of the ophthalmoscope, and I'll have my fourth and fifth finger out, so that way I don't get too close to the patient. I'll also use my other hand, my opposing hand, or non-dominant hand, to hold the eyebrow up. I'm going to go in at I'm at 15 degrees in his line of sight, and I'm going in at, I'm about 15 inches away. So I'm going to move in, and let me see, I'm gonna actually turn you a little bit. Okay, so I am gonna have you just look straight ahead of that buffalo picture, and I am going to, okay, so I immediately see that the lens and the cornea are free of any opacities. I can see the red reflex. I can see the retina is a reddish orange color. I can see the structures inside the eye. I can see the large veins that are larger and darker, and the smaller and lighter arteries. I can see the macula and the fovea, which are responsible for clear, crisp, central color vision. And I can see the optic disc and the cup. The cup to disc ratio is 1:3. I can see the optic disc is a creamy yellow pink color with sharp margins. And I can also see that there's no cotton wool spots, no AV nicking, and there's no hemorrhages. And that is a normal finding. I'm going to move over, and I'm going to do the same thing on the left side. I'm going to use my left hand to his left eye with my left eye, and then go ahead and look at the dog picture. And as I'm entering in, I have found the red reflex, and I can see the structures inside the eye. I can see the I can see the optic disc and the cup. The cup to disc ratio is 1:3. The disc margins are sharp. The color is a creamy yellow pink. I can see the large veins, larger darker veins, and smaller lighter arteries. And there's no AV nicking, no cotton wool spots, and no hemorrhaging. And I can see the macula and the fovea as well. And the cornea and the lens are clear, and they're free of any opacities. So I have the same assessment bilaterally. And that concludes the assessment for the optic nerve, which is cranial nerve 2, which is intact. So next I am going to test cranial nerve 3, and I'm going to test cranial nerve 3, 4 and 6. 3 is the ocular motor, 4 is the trochlear, and 6 is the abducens. I'm going to start this with the pupillary light reflex test. So I am testing the left pupil. As I shine the light in it, I can see that the pupil constricts from 5 millimeters to 3 millimeters. And then on the right side, the pupil constricts from 5 millimeters to 3 millimeters with direct light. As I shine the light in the left pupil and I assess the right pupil, I can see that it also constricts from 5 millimeters to 3 millimeters consensually, which is a normal finding. And then when I shine the light in the right pupil, I can see the left pupil also constricts consensually from 5 millimeters to 3 millimeters, and that's a normal finding. So that is ocular motor cranial nerve. So that's cranial nerve 3. The other thing that cranial nerve 3 does is it's responsible for most of the extraocular movements, with the exception of lateral movements and medial downward movements. Lateral movements is cranial nerve 6, the abducens, and medial downward is cranial nerve 4, the trochlear. So I'm going to assess these cranial nerves with the 6 cardinal fields of gaze. So don't move your head, just look at the pen. And I'm going to have you, so cranial nerve 3, cranial nerve 6, cranial nerve 3, cranial nerve 3, cranial nerve 6, and cranial nerve 3. And then cranial nerve 4 would look something like this. So together and to the middle and down. And as I was doing that, I noticed there was no nystagmus. If there was nystagmus, I would count the beats and document that. So that is cranial nerve 3, the ocular motor, cranial nerve 4, the trochlear, and cranial nerve 6, the abducens. Moving on to cranial nerve 5, the trigeminal. This is both a motor and a sensory nerve. So I'm going to have you open your jaw against some resistance. Great. So the motor function of the trigeminal nerve is intact. And then close your eyes, and you're going to tell me if you feel dull or sharp.
Dull. Sharp. Dull. Sharp. Dull. Sharp.
Okay, and you can open your eyes. And so now he was able to identify the difference between sharp and dull, so the sensory portion of the trigeminal nerve is also intact. Cranial nerve 6, the abducens, I've already explained. Cranial nerve 7 is the facial nerve. So I'm going to have you lift your eyebrows up like you're very surprised and then puff out your cheeks. Good job. So cranial nerve 7 is intact. Cranial nerve 8 is the vestibulocochlear, or the auditory or the acoustic nerve. So we'll start this with the whisper test. So I'm going to have you push in your tragus and then move circularly. And I'm going to stand 2 feet behind you and I'm going to whisper some letters and numbers, okay? A, 1, 2.
A, 1, 2.
Good job. And then switch.
A, 2, 4.
Great. So he was able to identify what words I whispered, so he passed the whisper test, which is testing for gross hearing. The next test is the Weber test, which is testing for lateralization. So I'm going to place this on his head, and then tell me, do you hear this equally?
Equally.
Okay. Or do you hear it stronger or louder in one ear or the other?
Still equally.
Okay. So he hears this equally in both ears, which that is a Weber symmetric test. Or a Weber equal test, which is an expected finding. Next is the Rin test. So I'm going to place this on the mastoid bone behind your ear. Can you hear this?
Yes.
Tell me when it stops.
It stops.
Can you hear this?
Yes.
Great. So the air conduction is greater than the bone conduction in the right ear. We'll do this on the left. That's a little loud. Can you hear this?
Yes.
Did it stop?
Yes.
And can you hear this?
Yes.
Great. So air conduction is greater than bone conduction bilaterally. And that is a normal finding. So that tells me that the vestibulocochlear cranial nerve, which is cranial nerve 8, is intact. So 9 and 10 we will test together. So first, cranial nerve 10 is the vagus nerve, and you could elicit a gag reflex. I'd also like to see you swallow. Good job. And then I'm going to have you just open your mouth, and I'm going to have you say ah. Okay, and so I was able to see the soft palate move symmetrically up, and the uvula is midline, and so that tells me that cranial nerve 9 and 10 are intact. He was able to say ah, swallow, and then I could also elicit a gag reflex. Cranial nerve 9 is the glossopharyngeal, and cranial nerve 10 is the vagus. Cranial nerve 11 is the spinal accessory. I'm going to have you shrug your shoulders. Good job. So his trapezius muscle is nice and strong, and then I'm going to have you just rotate your head against my face or my hand. Good job. And then again, so that's testing the strength of that sternocleidomastoid muscle, and I would rate that muscle at a rate of 5. It's normal and strong and expected. And it's the same bilateral. And then cranial nerve 12 is the hypoglossal nerve, and I'm going to have you just stick your tongue out. Good job. Wiggle it side to side. Good job. And then I'm going to have you push it against my hand. Okay, and then against my hand. Great. So the hypoglossal nerve, cranial nerve 12, is intact and has good movement and deviation and good strength. So now I'm going to test the cerebellum function. So the first thing I'm going to have you do is I'm going to have you just take a couple of steps towards the computer. Okay, and then come back. Okay, so as he was walking, I was able to see that his gait is symmetrical, his gait is steady, and I didn't see any loss of balance or coordination and no abnormal gaits like shuffling or staggering. So the next thing I'm going to have you do is I'm going to have you do a tandem gait. So I'm going to have you do a heel-toe walk, just like this. So if you can do the tandem walk, I would appreciate that. Heel-toe, heel-toe. Great. Awesome. So as I was watching him do this heel-toe walk, I see that his gait is, again, symmetrical. His balance is good. There was no loss of balance. His coordination is intact, and that's a normal finding. And then I'm going to have you walk on your toes and walk on your heels. So walk on your toes to the computer. Great. And then walk on your heels back. Great. So this shows me that he has good plantar flexion, good dorsiflexion, and then he also has good movement. He has good balance and coordination. And the other thing I'm going to have you do is I'm now going to have you stand up. We're going to do the Romberg test and the plantar drift, the pronator drift test. I was looking at your feet. So to do the Romberg and the pronator drift test, I'm going to have you put your hands out like this and put your palms up like you're holding 2 bowls of soup. Okay, and then I'm going to have you close your eyes. Okay, and so I would observe him for 30 to 60 seconds and look for any swaying, loss of balance, or coordination. And I would look for any pronator drift, which would look like that. I'm also going to top the hands. and they come back up and he doesn't lose his balance. Go ahead and open your eyes and sit back down. So that tells me that he had a negative Romberg test and a negative pronator drift test. Next, I'm going to have you do the rapid alternating movement. So I'm just going to have you do the hands to the lap test. Great, and that is symmetrical, and he's able to do that without any trouble. He is able to do it symmetrically, coordinated, and he does it. So that completes the cerebellum test. All of these tests were completed appropriately, and that tells me that his cerebellum is functioning appropriately. The next thing I'm going to do is I'm going to start with the sensory test. I'm going to move this down a little bit so you can see the feet. Okay, so the sensory test, the first thing I'm going to do is I'm going to do the joint sense test, which is like proprioception. It's when our body really knows where our bodies are, like our bodies know where our joints are at all times. So I'm going to have you close your eyes and then tell me which direction your toe is pointing.
Up.
Okay?
Down.
Great.
Down. Up.
Great. So he passed the joint sense test. He was able to tell me the correct positioning of his toes. The next test I'm going to do is the 2-point discrimination. So I have a little paper clip that's opened up. So I have 2 points, and I'm going to have you tell me, with your eyes closed, I'm going to have you tell me if this is 2 points or if it's 1 point.
2. 2. 1. 2. 1. 2. 1. 2. 2. 1.
Okay, and then we'll do your lower extremities.
2. 1.
Move this arm.
2. 1. 2. 2. 1.
Good job, and then we'll do this side.
2. 1. 2. 2. 1.
Great. So he was able to pass the 2-point discrimination test. He was able to identify when he had 2 points touching him versus 1 point. And that is a normal finding. The next thing I'm going to do is I'm going to do a test of graphesthesia. So I'm going to have him close his eyes, and I'm going to draw a number or a letter on his hand, and I'm going to have him tell me what it is. Okay?
3.
Good job.
S.
Great job. So he passed the graphesthesia. The next thing I'm going to do is I have a cotton ball, and I have the back of my cotton tipped applicator, my wooden one, and I'm going to do the superficial tactile sense and then superficial pain sense. So with the cotton ball and the back of the cotton tipped applicator. So I'm going to have you close your eyes, and I'm going to have you tell me if I'm touching you with the cotton ball or if I'm touching you with the cotton tipped, with the little wooden stick. Okay? Does that make sense?
Yes.
Okay.
Cotton ball. Pin. Cotton ball. Pin. 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 Cotton ball. Cotton ball. Pin. Pin. Cotton ball. Pin.
Good job. Now let's do your lower extremities.
Cotton ball. Pin. Cotton ball. Pin. Cotton ball. Pin. 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 Cotton ball. Pin. Cotton ball. Pin. Pin. Cotton ball. Pin.
Great. So he was able to identify that correctly. He was able to tell me if he was being touched with a cotton ball or a pin, so he's able to discriminate between a soft and a painful sensation. The next test I'm going to do is I'm going to do the vibration sense on the bilateral big toe. So I'm going to strike this, activate it, and see if you can feel vibration after I place this on the interphalangeal joint. Can you feel the vibration?
Yes.
Okay. Can you feel the vibration?
Yes.
Great. Okay, so that completes the test for sensory or sensation. The next, so his sensory, he was able to complete all of those tasks, so I feel like his sensory system is intact and is appropriate. So the next test that I'm going to do is I am going to do the motor test. And so the motor test is going to do some muscles. So I'm going to compare your muscles bilaterally. So I'm going to start with your I'm going to do deltoids, which is here, okay? And these are your biceps and these are your triceps, okay? And so I'm going to push in and I'm going to have you push out, and then I'm going to pull forward and you're going to pull up, and then I'm going to push up and you're going to pull down, okay? We can go over it again though. So I'm going to push in and I want you to push out. Good job. So I'm going to say these are bilateral and symmetrical. Bilateral strength of 5. And then for your biceps, do a curl. And then I'm going to pull down. I want you to pull forward. Good job. So that is, again, bilateral and full strength at a 5. And then I'm going to pull, let's see, I'm going to push up and you're going to pull down. Okay. And again, so the triceps, that is a bilateral +5 normal. I'm now going to have you do a hand grasp. So I want you to squeeze my fingers. Give me a good squeeze. Good job. And then I want you to put your hands out and abduct your fingers, so out like that. Don't let me close them. Good job. And then I'm going to have you put your hands together to adduct. Don't let me open them. Okay, and then make a fist. Don't let me open it. Okay, so he is symmetric bilaterally with all of these upper body muscular strengths. And they're all normal and +5. Now I'm going to test your lower extremities. I'm going to test your quadriceps, your hamstrings, and then your adduction, which is your hip adductors pushing together, and then your abduction is your hips pushing apart, okay? So first, I'm going to pull up, and I want you to push your legs down. Good job. Okay, so that's bilateral and full strength, and then I'm going to push down, and you're going to push up. Good job. So that's bilateral and full strength, and then I'm going to push in, and you're going to push out. Oh, okay. And then that is bilateral, full strength, and I would rate all of these at a 5, and then I'm going to pull, and you're going to pull back. Good job. So again, that is a bilateral +5. Now I'm going to do the hip adductors and abductors. So I'm going to push in, so this is me pushing in, and you're going to abduct out. Good job. So that's a +5, and bilateral equal, symmetrical, and then I'm going to push out, and you're going to pull in. Good job. So that is bilateral equal +5. The last thing I need to do is I need to do the deep tendon reflexes. So I'm going to start with the Babinski, and I'm looking for, there we go. So that was negative Babinski. There was no dorsiflexion of the big toe. Okay, and that was also a negative Babinski. There was no dorsiflexion of the big toe. Next, I'm going to do the Achilles tendon. So I'm going to dorsiflex the toes. There we go, and give a slight strike to the Achilles with the larger part of my hammer, and he did have a +2 normal reflexive reaction to that. And again, he had a normal reaction on that side. Next, I'm going to do your patellar reflex. So I'm going to have you put your hands like this and pull. Good job. You got strong reflexes. Okay, and that's a +5. That is, or excuse me, that's a +2 normal reflex. The next reflex that I will do is I'm going to do the, I need to do the biceps. So let's see if we can do this. Sometimes it's easier to do this. Let me see. I'm going to do it this way. I'm going to have you have your elbow slightly bent, have your palm down, and then I'm going to just relax, okay? Super relaxed. That is a +2 normal reaction, and then we'll do the tricep. So this is going to be kind of like, let's see, you can put your hand like that, and we'll see if I can elicit a reflex that way. Just relax. It's got to be super, super relaxed right here. There we go. Okay, that was that reflex, but I didn't like it as much as I like it this one. So that's a +2 on that bicep and tricep tendon reflex. And then we'll try this one. This one seems to work a little bit better. Okay, so that's a +2. And then we'll do this way. I don't want to hit directly on you. Gotta relax, okay? And then on the bicep and tricep on the left side, I also got a +2. So all of his reflexes are within normal limits. They're all normal. They're all reflexive and appropriate for, they're appropriate. So that concludes the neurovascular assessment. As I was comparing side by side, everything is within normal limits. Everything is symmetrical. His strength is appropriate for his age, and I do not have any concerns that there's any neurological deficits with any alterations in strength or sensation.